Are you like most people? At times you may have a question for your doctor, but you can't get to him or her, so that you may ask your question. Good news. Your worries are over. Because the Mount Pilgrim Missionary Baptist Church, in partnership with Caldwell UNC Healthcare, bring to you Let's Talk to the Doctor, a 15-minute talk with real doctors from the Caldwell UNC Healthcare, designed to educate and answer questions that are a concern in our community. Let's not forget, our communities perish for the lack of knowledge.
Well, good afternoon, and welcome to our third segment of Talk with the Doctor. We're so just glad to be here, and I think that our first two sessions have been so successful, and I thank all of you for taking the time out to send us questions, and I hope that we answered your questions to your satisfactory. However, there are a couple that we did not get, and we expected that, so we plan to address those today. So thank you again for tuning in, and I hope that everything done today will be satisfactory to you. So at this time, without further ado, I'd like to introduce Ms. Deborah Ashley Smith from Caldwell United Healthcare, and she will introduce our guest speaker today, and we'll move from there. Thank you.
Thank you very much, Reverend Perkins. And we are very thrilled to be back again with you today. Caldwell UNC Healthcare is a great partner with yours, we believe, and you are a great partner with us. And so we're going to talk today about the COVID virus. In our first two sessions, we talked more about the flu. But Dr. Lowry has a wealth of knowledge, and it's growing every day, actually. So, as you know, Dr. Lowry is our Chief Medical Officer and serves in such a valuable capacity at the hospital. He is involved in everything that we do, and so I'm going to ask him a few questions, and let's get to the basics of what COVID-19 is.
Sure.
Something we'd never heard of before the end of last year, right? So tell us, what is it?
Well, COVID-19, and the first thing I'd say is I wish COVID-19 would have stayed in 19. It was named COVID-19 because it first started in China at the very end of 2019. And who would have thought now, 2 days shy of 2021, that we'd still be dealing with this. But COVID-19 is a virus. It's an upper respiratory virus that affects humans. And you've probably heard it called coronavirus. And coronavirus is a term, it's a family of viruses. And COVID-19 is a specific virus within that family. It's kind of like the bad sheep of that family, because most coronaviruses are relatively harmless or fairly harmless. Like the common cold is caused by a coronavirus, but specifically COVID-19 is a lot different, behaves a lot differently. Some of you may remember a few years ago there was a really bad epidemic, what was called SARS, S-A-R-S, and that was a coronavirus also. It didn't really affect the United States that much, but unfortunately COVID-19 has. Again, it's primarily an upper respiratory infection involving the nose and sinuses and lungs, but has a lot of other effects on various parts of the body that we're just now beginning to understand.
So it really was a new form of that virus.
Correct, and we don't know exactly why it developed, why it became so prevalent. Is it a new virus, or is it one that was perhaps affected animals and was somehow transmitted to humans? Of course, there's been a lot of speculation. Could it have been the result of an experiment in a in a laboratory. Nobody really knows for certain, but we do know that it's here now.
Does it seem to be more contagious and more easily spread than some of the other?
Yes, it's very contagious for several reasons. Like the flu, it's spread primarily through droplets. When we breathe or when we sneeze or cough, little microscopic droplets are come out and stay in the air and eventually land on surfaces. And this virus is able to stay alive for a period of time, sometimes even 2, 3, or 4 days on certain surfaces. So if you're in a crowded room or around others and they happen to breathe or sneeze or cough, you can inhale the virus droplets directly and become infected that way. But in like manner, if you touch a surface where there are living viruses and then you touch your face or your mouth or your nose, you can be contaminated in that way as well.
So is this virus more serious than the flu for the general population?
It's much more serious, and not that the flu is not serious. And as you may remember in our last podcast, we mentioned that the flu on a typical year kills 20 or 30,000 Americans per year. It's very dangerous, but this is much more dangerous for several reasons. It seems to be more contagious. The incubation period is much longer. So, and what I mean by that, someone can inhale the virus and the virus can be incubating inside them for up to 2 weeks before they actually develop symptoms. And for 2 days or so before they develop symptoms, they're actually contagious and can spread the virus to others. So in many cases, people are spreading the virus before they even have symptoms. And then the virus itself has a lot of activities that are poorly understood. For example, it's a respiratory virus, but it seems to make the blood clot. And what's been found is that people who are affected with severe cases tend to have blood clots that form. They have more strokes, they have heart attacks, they have what are called pulmonary emboli, or blood clots in the lung, that are directly caused by the effects of this virus, and we don't understand why that happens. Athletes, young people who have this virus, you may have heard, have effects on the heart, where the heart muscle itself is weakened after the virus. And there are reports now that people who've had severe infections may actually have long-term or longer-term cognitive deficits, where they have trouble thinking or have effects on the brain. So it's a very complex virus that's just very dangerous.
Since it lays dormant in a person's system, what would be the first symptom that would tell them, hey, look, I don't know necessarily the virus, but what would cause them to?
Yes, so that's a very good question. And as you recall with the flu, almost always people have a shaking chill, they develop a dry cough, they get a fever and have aching muscles. And oftentimes that can happen with COVID. But sometimes people have none of those symptoms. They may develop nausea or vomiting or diarrhea, or they may just have sinus congestion. They may have a sore throat. And one of the more unusual manifestations is when people have a loss of taste or a loss of smell. That doesn't always happen, but it's very common. In patients I've talked to, quite frequently now, they seem to have a lot of sinus congestion, aching muscles, and just a feeling of being very, very tired. I'm just wiped out. I don't know what's wrong, but I just feel so tired. That seems to be a very common presenting symptom.
So when someone has the symptoms like that, it can be difficult to determine exactly what the cause. So how do you really deal with that? I mean, otherwise, I guess that's why there's so many people get tested, because they're just not sure.
Right, it's very difficult, especially if people have a cough and a low-grade fever. It looks very similar to the flu. So, or if they have a sore throat, especially in younger adults and teenagers or children, it's very similar to strep throat. So in our drive-through diagnostic clinics now, if someone has those symptoms, we do a flu test and a COVID test at the same time. I think the key point to know is, though, that this virus is so prevalent in the community that if you have even what are mild symptoms, it's important to get tested. The wrong thing to do would be to say, oh, this is just a cold, or this is sinuses. And the reason being, especially if you're in a high risk group, the symptoms can worsen pretty quickly. And there are some treatments now that can prevent people in high risk groups from getting sick once we have the diagnosis.
So when we talk about the older population, it's not just older, it's people with any kind of medical issue that they deal with
Right.
chronically.
Far and away, the biggest risk factor for complications and death is age. So the risk of a 50-year-old dying from COVID as opposed to a 20-year-old, it's 100-fold greater risk. And the risk of a 100-year-old dying as opposed to a 50-year-old is another 100-fold risk. So the risk of a 100-year-old versus a 20-year-old dying is a difference of 10,000. So age is exponentially a factor. The older you are, the higher your risk, especially age 65 or greater. But other risk factors are important. Anyone with a history of active cancer, someone who's getting chemotherapy, anyone who's on any kind of immunosuppressive therapy, for example, someone with rheumatoid arthritis, a patient who might have HIV with a low CD4 count, or even younger patients with diabetes, heart disease, high blood pressure, chronic lung disease. Those are risk factors as well. And then for some reason that we don't understand, a heavier weight is an independent risk factor. So people who are on the heavier side and even with people who are mildly overweight, that is a risk factor as well.
Now, if a person 65 or older and has taken real good care of themselves, have exercised and do a lot of workouts, does that help their system to fight it off, or are they still just as...
They are still at high risk, and the healthiest 65-year-old in the world is still at higher risk than a younger person. Now, a 65-year-old who has a lot of medical conditions on top of it is at even higher risk, but even a totally healthy 65-year-old is at high risk.
So if someone is taking a lot of medication, does the medication itself potentially have some influence in how much, how bad the symptoms might be? Or is it just the condition the medication's treating? Because I know a lot of people have asked that question.
It's just the underlying condition. The medicine wouldn't have any adverse effect unless it's an immunosuppressive therapy. So for example, someone who's on chronic prednisone at high dose, or somebody who's on chemotherapy medicines, or somebody who's on some sort of immunosuppressive medicine, those medicines suppress the immune system and weaken your immune system, and that would increase the risk.
So if you were a person who had symptoms and you had been even mildly possibly exposed to someone, come in contact either because you've gone into the grocery store or you've been in a workplace and they have even the mildest symptoms, they need to be overly cautious.
I think so, especially given that this virus now is spreading so rapidly in the community. And it's important, especially for those in high risk groups, to know if they have COVID or not. For one thing, if a person has been confirmed to have an infection, they can isolate themselves from others to prevent others from getting it. But also there are some treatments now to help in those who have been diagnosed who are in high risk groups. And in particular, a class of medicines called monoclonal antibodies have been approved within the past few weeks for outpatient treatment of people with confirmed COVID who fall into those high-risk categories we've been talking about. And if those patients receive a treatment with this medication, it can greatly reduce the risk of getting sicker and ending up in the hospital.
So we've all just gone through the Christmas holidays, and hopefully most of us are feeling pretty good about it, but we're not out of the danger yet, and this is why we know that maybe there's some really difficult times ahead.
We unfortunately think there are. The modeling that the experts have done in North Carolina at this point is not taking gatherings from Christmas into account. And those models are showing that the current rate of climb is still upward at a fairly steep angle until about the middle of February. And then it should begin to decline, but it will take another month or so to get back down even to the state that we're at right now. So we're talking about mid-March at that point. Now, there are two factors that's not taking into account. One is gatherings over Christmas and New Year's, which we think could worsen that projection. But the other's the vaccine, which we think will become available on a fairly wide basis after the first of the year, which could decrease that trend.
If I've been discharged from the hospital, my doctors have written off, what are the other necessary precautions other than the mask, the social distances, and washing my hands? What other precautions should I be cautious of?
Yeah, so that's a good question. So assuming that someone has had COVID and whether they've been in the hospital or not, we know that within about 10 days or so after symptom onset, there is no longer shedding of the virus in the nasopharyngeal secretions. So people are felt to not be contagious to others after about 10 or 11 days. And if someone's been sick with COVID and 10 or 11 days have gone by and they don't have a fever and their symptoms are improving, we consider them to be recovered. Even though they may not be back to normal, they're recovered from COVID. And the thought is that it's very unlikely for those people to get infected with COVID again, at least within the first few weeks after an infection. But we still encourage those people to wear a mask and take normal precautions as if they haven't had COVID, because to be honest, we just don't know yet how likely it is for someone to get reinfected. Would I ever give 100% guarantee to somebody that there's no way they could get reinfected? No, I would not, because I just don't know, nor does anybody. Also, it's important to model good behavior for others. And people oftentimes listen to somebody who's had a COVID infection more than they would listen to somebody who hasn't. So if Pastor Ike, for example, said, you know, I've had COVID and I'm wearing a mask because it's the right thing to do, I think people are going to be more inclined to follow his lead because he's kind of become an expert on it. I haven't had it.
So,
Go ahead.
I was just gonna say, we've tried to cover a lot of topics here, and we're gonna cover even more in the next segment that we do about COVID, but did you have any additional questions?
I have one more that I need to get this in or I'll have to leave the city. Is it true that people with type O blood, that they are less likely to contract the virus?
That is a great question, and actually whoever asked that question has been reading the literature, because
he's listening.
yeah, and obviously he's a smart guy, because there are reports that people with type O blood don't seem to get COVID as easily as others. However, that doesn't mean that they don't get COVID at all.
Right.
So I think it's important to know that if you have type O blood, you can still get COVID. But there is something about that that's interesting and goes to the root of the fact that we just don't know a lot about COVID. And I mentioned earlier that COVID seems to cause more blood clots than would be expected. So that tells us there must be something in the way that virus or something about our immune response to that virus interacts with blood cells and with blood clotting. So that's, I think, probably an area that some researchers are probably looking at. But yes, that is true. There does seem to be less COVID among those with type O blood.
That'll be something really interesting in hindsight after this
Yeah.
is all over to really know, won't it?
Probably
Yeah,
somebody will win the
absolutely.
Nobel Prize after figuring that out or something.
Well, Reverend Perkins, we really appreciate you allowing us to be here for another segment.
Well, as always, I think the more we become aware of what we're going through, the better we are to go through with what we're going
Yes.
through. So I thank you, Doctor, and I
You're
thank you,
welcome.
Deborah, so very much for being here and sharing with us. I think that the sessions before has added a lot of information for our people. And these questions, and I'm gonna try to get them all in because I have to face these people. But
That's right.
I'm just so glad that they took the time out to show interest to ask the questions. So
Sure.
thank you guys
Thank
so very
you.
much.
Thank you.
for having us.
What an informative and educational segment. Reverend Perkins and the Mount Pilgrim Media Ministry want to thank you for tuning in. We are located at 539 Willow Street in Lenoir, North Carolina. Please visit. We would love to see you. Join us every Thursday, right here at 7 p.m. with another segment of Let's Talk to the Doctor. Be blessed, and we look forward to seeing you next week. We would like to thank our partners, Caldwell UNC Healthcare, as we are doing good in the neighborhood. Please hit your share button at this time.